Hello and welcome to
NCTV episode 61 and part 3 of 3 in the hip replacement series, which will be about what to do after you've had hip replacement surgery. To cover this, we'll break this down into two sections, one being on rehabilitation and the other on the do's and don'ts following surgery. First of all, it should be known that surgery without rehabilitation will not ensure a successful outcome. Ultimately, years of pain, reduced physical activity or function, muscle weakness, and the development of a limp, for example, will have become the norm for the body and the mind. Rehabilitation will therefore help to restore function and retrain the muscles and nerves to work together, which will recondition you to optimal health, function, and well-being. So when to start rehab? Ideally, before you've actually had your surgery, with education and strengthening exercises. However, progress through rehabilitation can always be achieved at any time, as long as you start somewhere, and the sooner you start, the better. Rehabilitation and physical therapy can start immediately after surgery and continue throughout hospitalisation and at home for up to about a year after surgery. In hospital, this could even be as early as 6 hours after surgery, with a few exercises in bed to promote blood flow, reduce your risk of developing a clot, and help to build strength. The sooner you mobilise, the better, and this may be in the form of a short, slow walk around the room to start with, gradually increasing the distance and duration over the next few days. As your walking gradually improves, you normally continue using crutches or a walker for up to 6 weeks after surgery, sometimes less, but it depends on your surgeon's views, as well as your weight and age. When it comes to tackling stairs, you may want to have someone to help you until you've regained most of your strength and mobility. Remember the following phrase: up with the good. So 1, hold onto the handrail with one hand and a crutch or a cane with the other where possible. Otherwise, use both crutches together. 2, step your good leg up first and then bring your operated leg and the cane and the crutch onto the same step afterwards. Next is down with the bag. So 1, as before, hold a handrail with one hand and a cane or a crutch in the other where possible, otherwise both crutches together. And 2, step down with your bad leg along with the cane and crutch at the same time, then step down with your non-operated leg onto the same step. This is important to get right because being able to walk and climb stairs safely is one of the mandatory requirements for discharge from hospital. A few tips to help you through the rehabilitation phase. Firstly, you can ice the operated hip for around 10 minutes, especially after exercise, and as needed every few hours. Pain medication prescribed by the hospital, taken 30 to 45 minutes before your daily exercise, can also help you to control the pain so that you can actually perform the rehab as required. To control and reduce the swelling, this can be done by lying flat on your back and elevating your leg above the level of your heart with pillows. If you're increasing increased stiffness or soreness, it may be that you're not doing enough exercises or holding the stretches for long enough, so try to increase the number of times that you do them for and aim to hold the stretch for around 20 to 30 seconds. Conversely, you'll know if you've done too much because there will be an increase in hip pain and swelling or an increase in night pain, in which case respect the pain and increase your rehab more gradually to take more breaks. It's also wise to avoid being in one position for too long. In terms of resuming an active lifestyle, 6 weeks after surgery, you can cycle on a recumbent bike and swim as long as your incision is healed, but avoid breaststroke. 12 weeks after surgery, and you can look at resuming golf, gardening, provided you avoid excessive bending, sitting in a bath, preferably with grab bars, gentle dancing, and cycling on a regular bike, raising the seat again to prevent excessive hip bending. In summary of the rehab section then, when it comes to general fitness, remember to start slowly as you have been less active since your surgery. Start with a few minutes of activity and and gradually progress. Low impact activities are best, such as swimming, biking and walking. Now a few do's and don'ts that you should know about. Firstly, the don'ts. To ensure that your hip doesn't bend past 90 degrees, 1. Don't sit on soft or low furniture or beds. 2. Don't bring your knees to your chest. 3. Don't squat. 4. Don't reach forwards while sitting. Other things to avoid are crossing your legs, twisting or pivoting on the operated leg, pushing or carrying heavy items, and driving for the first 8 weeks following surgery. Now onto the do's, and these are: use a long-handled reacher to pick the things up that you need off the floor, and use a socket to put your socks and shoes on. If you side lie in bed, lie on the good side with a pillow between your knees for 4 to 6 weeks. Also take breaks on long car journeys to avoid stiffening up too much, and stretch and mobilise when you can, every 45 minutes to an hour. Recline your seat a little also, and if flying, book an arm seat so you can stretch your operated leg out into the aisle. Use a walk-in shower for washing to avoid clambering over a bath the first few weeks after surgery. And if you have to kneel, do it on the bad leg so that you can then push up and lift yourself with the good leg. So there we go, that concludes part 3 of 3 on our hip replacement series. And I'll see you next time for small bite-sized bits to help your health flourish. Bye for now.